Don't get too disheartened if you're celebrating Valentine's Day alone this year. It could be bad for your heart. Hello everyone, my name is Dr. Hafez Nadiri and I'm a cardiology trainee in London, currently undertaking a PhD. If you're new to the channel, here I educate on heart health and cover topics relating to cardiology. In this video, I'm going to talk about Takotsubo cardiomyopathy, which is also known as stress cardiomyopathy, or you may have heard of it referred to as broken heart syndrome. This is a fascinating condition that can mimic a heart attack in terms of its presentation. It's triggered by a stressful or traumatic event, like a breakup or a death of a loved one. The term Takotsubo is a Japanese word for an octopus pot. So how does this octopus pot relate to this condition, I hear you ask? Essentially, the pot resembles the shape of the heart in this condition. On imaging of the heart, it has a characteristic look in that the tip of the heart, what we call the apex, balloons out. So you can appreciate that it looks very similar in shape to the pot. In this condition, you essentially get an acute left ventricular dysfunction, so the heart function suddenly declines. So what's the underlying pathology? Well, there is considerable evidence that enhanced sympathetic activity plays a big role. During a stressful event, you get a sudden surge of hormones like adrenaline, which causes your heart rate to rise and increases the pumping action of the heart. As a result of this, you get this stunning of the heart. Takotsubo is more common in women and risk increases with age. Typically, patients experience severe chest pain, feel clammy, and sometimes can feel breathless or experience palpitations. Does this sound familiar? It sounds a bit like a heart attack, right? The ECG can look similar to a heart attack too, with ST elevation or depression with non-specific T-wave changes. Troponin levels also rise. Troponin is a chemical released by the heart muscle when it's injured or under stress. Because this condition can mimic a heart attack, patients often end up getting a coronary angiogram to look at the coronary arteries for any blockages. In Takotsubo cardiomyopathy, the vessels supplying blood to the heart are normal. So there is no angiographic evidence of a heart attack. Heart imaging is key here, so an echocardiogram and a cardiac MRI can help to make the diagnosis. In both imaging modalities, you see this characteristic shape of the heart and also a weaker heart. Another feature in cardiac MRI is the absence of gadolinium enhancement on delayed imaging, but you may see myocardial edema in areas where the heart is weak. The good news is that the weakness of the heart in this condition is temporary and usually improves over weeks and months. Treatment is supportive and is similar to heart failure therapy. Repeat imaging is therefore important to ensure the heart function is back to its normal baseline. And in the majority of people, their heart function returns to normal. They would normally have a few follow-up appointments to ensure there is no relapse. So to summarize, Takotsubo cardiomyopathy is a condition triggered by a stressful event and causes the heart to become suddenly weak. Treatment is supportive and most patients recover the heart's function. Thank you for watching and I'll see you in the next video.